You are 19 years old. There is an IV in your arm. A face is floating above you, masked, loops down, calm. You hear a voice count backwards from 10. You make it to 7. The person standing over you trained for 11 years, undergrad, dental school, 4 years of hospital residency, for your wisdom teeth. And wisdom teeth are the easy part of what they do. Level 1, pre-dental student. You are 19 years old again. It's 1 a.m. in a fluorescent-lit library. You didn't plan to be a dentist. You were pre-med. Your MCAT came back lower than you needed, or you looked at the hours a doctor works and decided you wanted a life too. Your roommate got into medical school. You didn't. You are telling your parents that dentistry was always the plan. You are telling yourself the same thing. In front of you is a block of white soap and a small carving knife. The DAT has a manual dexterity section. They make you carve a tooth out of soap. It has to be symmetric. It has to look like a molar. You do it wrong. You start again. The bite wing radiograph section is next. You memorize the shapes of cavities on black and white film. You memorize the Latin names of the muscles of the jaw. You do not sleep more than 5 hours a night for 6 months. You spend $2,300 on a prep course. You take the DAT in April. You wait for your score. You don't know yet that dental school will be harder than the path your friends took, harder than the roommate who got into medical school. You think you took the easy route. The letter comes in March. Level 2, dental student. You are 22, you owe $200,000 already, and you haven't finished year 1. They call it pre-clinic. It's a room with 40 drill stations and 40 plastic skulls. Your skull is in front of you. Your hand instruments are lined up to your right. You are drilling a cavity into a plastic tooth. The cramp starts in the web between your thumb and forefinger. It's a tight, specific ache. It will come back every day for the rest of your career. Your first live patient is in year 3, a man in his 50s. You numb the wrong side of his mouth. He doesn't say anything. You do it again on the correct side. You apologize. He says, "You're learning. Take your time." You almost cry in the operatory. DDS and DMD are the same degree. You thought one was better. You find out in the first week of school. The debt is its own reveal. You will graduate owing more than a new house costs in most of the country. You will start paying it back within a year. You work 60-hour weeks in the pre-clinic. You do not see your friends. You do not call your family. Your hands hurt when you open a door. The classmate struggling next to you is going to be the best oral surgeon in your state in 15 years. You don't know that yet. Neither does she. You graduate in May. You sign your first contract in June. Level 3, general dentist. You are 26 years old. You are standing in your first operatory, in your first pair of scrubs that are yours, and the chair is reclined in front of you. The chair, vinyl, overhead lamp, spit cup, rinse water, patient looking up. You will see this chair every day for the next 30 years. 28 patients are scheduled today. Your assistant hands you a bite wing at 8:03 a.m., a cavity on tooth 14. You numb it, drill it, fill it, cure it, adjust the bite, and walk to the next room. 7 minutes. The next room is a hygiene check. X-rays, smile, nothing wrong, move on. The room after that is a crown. You grind the tooth down to a stub, take an impression, seat a temporary. The room after that is a kid screaming in a parent's lap over a baby tooth. The last patient of the day hasn't been to a dentist in 15 years. He needs $6,000 of work. He doesn't have $6,000. You sit with him in the operatory and try to build a plan he can afford. You stay 40 minutes late doing the math. You do a root canal at the end of the day. It takes you 90 minutes. The insurance company downcodes it. They pay you less than the cost of the supplies. Nobody warned you about the loneliness. You went to dental school with 100 classmates. Now you are the only dentist in the building for 10 hours a day. There is nobody down the hall to ask. There is nobody at lunch. Your lower back starts hurting in month 4. Your neck goes next. By year 3, your right wrist wakes you up at night. Your total compensation is $160,000. You are in the 95th percentile for your age. You are also in debt up to your ears, and you have not touched your loan balance in 2 years. You start Googling residencies on your lunch break. Level 4, Oral Surgery Resident. You are 28 years old. You are in scrubs again, and it is 3 in the morning. You took a 50% pay cut to get here. You left a stable associate job. You are back to being the lowest ranked person in the building. But now the building is a hospital. Your stipend is $62,000 a year. Your loans are still being paid back at the rate of a general dentist's salary because you signed the paperwork before you left. You do the math in the call room at midnight. You stop doing the math. Your first rotation is general surgery. You are holding retractors on an open abdomen for a gallbladder removal. You have not touched a tooth in 6 weeks. Your attending asks you a question about bowel anatomy, and you get it wrong. He is not kind about it. You rotate through anesthesia next, then trauma, then the ICU. You are a dentist on a medicine team, and everybody knows it. You round at 5:30 a.m. You present patients to attendings who ask why a dentist is pre-rounding on their diabetic in bed 11. You do not have a good answer. Some oral surgery programs are 4 years long, others are 6 and include a full medical degree. You become a doctor on top of being a dentist. Same specialty, different path. You picked one. You will spend years wondering about the other one. 6 months in, you get your first trauma page. A man was hit driving home from a wedding. His lower jaw is broken in 3 places. His face is not where it's supposed to be. You scrub in. The chief resident talks you through the fixation. You hold a titanium plate against bone while he drills a screw through it. Your hands do not shake. You notice this and file it away. Year 2. You are doing your first wisdom teeth case unsupervised. 4 impacted thirds on a college kid. You remember being him. You place the IV yourself. You push the midazolam. You watch him count backwards from 10. Year 3 is when it starts to hurt. You have worked 90 hours a week for 26 months. You have missed a wedding, 2 funerals, and your niece's first birthday. Your partner tells you, gently, at first, that you have not been home on a Saturday since February. Your attendings have a name for dental school. They call private practice the shelter. They say it's where dentists hide from real dentistry. You used to live in the shelter. Now you are here, and sometimes you miss it so badly you cannot breathe. The hours are worse than anything you did as an associate. You make less money. You are learning things you could not have learned any other way. You don't know yet which case is going to break you. 4 years pass, or 6. You sign out of residency at 34. Level 5, private practice. You are 35 years old. You have your own office now. You bought into a 2-surgeon practice in the suburbs. The chair is back, but it's different. There's an IV pole next to it. There are pulse ox leads clipped to the armrest. There is a small cart of sedation medications by your left knee. It is 9 a.m. on a Tuesday. A 19-year-old is in the chair, wisdom teeth, all 4 impacted. Her mother is in the waiting room reading a magazine. You start the IV, you push the midazolam. She counts backwards from 10 and makes it to 7. You flap the gum back, section the tooth with a high-speed drill, and lift the pieces out with an elevator. You move to the next tooth, then the next, then the last one. 4 teeth. 45 minutes. You suture the gum closed with dissolvable thread. Your assistant wakes her up. Her mother drives her home. Not every morning is that clean. Last Thursday, a healthy 17-year-old's oxygen sat dropped into the 70s halfway through the second extraction. You pulled the mask off her face. You repositioned her airway. You squeezed the bag valve mask until her numbers came back up. Her mother in the waiting room never knew. You wrote your note and walked to the next room. You do this 30 times a week. You do dental implants in the afternoon, drill a titanium post into the jawbone, wait 4 months for it to fuse, screw a crown on top. You are very good at a very narrow set of things. Your total compensation is $540,000. You make more than most of your friends from medical school. You drive a car your parents would not have believed. The hours are good. You are home for dinner. You coach your kids' soccer team on Saturdays. Some nights you sit in your living room and think about the chief resident from your program. He stayed in the hospital. He's at a level 1 trauma center now. You wonder what he's doing tonight. You don't call him. Some oral surgeons stop here. It's stable. It's extremely well paid. It is a good life, and nobody gets to tell you otherwise. Others stay in the hospital, where the cases get harder and the nights get longer. Level 6, hospital surgeon. You are 38 years old. Your pager goes off at 3:47 a.m. You are not in an office. You are in an on-call room at an academic medical center. The voice on the other end of the pager is a trauma surgeon. He needs you in the operating room in 20 minutes. A 22-year-old was hit in the face with a fence post. His lower jaw is gone, not broken, gone. You are going to rebuild it. You walk into the operating room. There is no dental chair here. There is an operating table, blue drapes, a surgical microscope on a boom arm, and a team of 8 people waiting for you. You are going to take a 25-centimeter piece of bone out of his lower leg. The bone is called the fibula, the smaller one next to the shin. You are going to cut it into 3 wedges. You are going to shape those wedges into the arc of a human jaw. You are going to plate them together with titanium. Then you are going to sew one blood vessel to another. Each one is smaller than a grain of rice. Without them, the new bone dies in its new home. The case takes 12 hours. He wakes up in the ICU the next morning. His jaw is there. He cannot speak yet. His mother is holding his hand. You go home and sleep for 4 hours. You come back for clinic. The next morning, you are repairing a cleft lip on a newborn baby. Tuesday afternoon, your clinic is different. A 54-year-old woman, school teacher, 2 kids. She has a tumor on the floor of her mouth. You take her into the operating room on Thursday. You remove the tumor, part of her tongue, and a section of her lower jaw. You rebuild it the same way you rebuilt the fence post patient. Fibula, 3 wedges, titanium plate. 3 weeks later, the pathology report comes back. The margins are positive. The cancer is still in her. You call her yourself. You do not pass it to a resident. You sit in your office with the phone in your hand for a long time before you dial. There are cases you cannot fix. You trained for 15 years to do this work, and you still cannot fix all of them. You carry all of them. Your family members still call you the dentist. You have rebuilt more than 100 faces. None of them will ever look exactly the way they looked before the accident. But the people who wake up can eat again. They can speak again. They can look in a mirror without flinching. Your patients will thank the ER doctor who stabilized them. They will thank the anesthesiologist who put them under. They will not know your name. You are fine with that. Somewhere tonight, a 19-year-old is in a dental chair. There is an IV in her arm, an overhead light, a face above her, masked, loops down, calm. She hears a voice count backwards from 10. She makes it to 7. You have seen this scene before. At the beginning, the person standing over her is the one you just watched. 11 years of school and residency, 30 wisdom teeth cases a week, a 22-year-old whose jaw he rebuilt out of a piece of leg bone, and a 54-year-old school teacher whose name he still remembers, whose margins came back positive, whose phone call he made himself. All of them stand above this chair. She does not know any of that yet. And somewhere else tonight, there is a library and a block of soap on a desk. The girl carving it does not know either. She has never heard the word fibula. She thinks she took the easy route. In 3 years, she will be the one going under in a chair just like this one. In 15 years, she will be the one standing over it. Neither of them knows that yet. They'll find out. Everyone does.